Welcome back. I hope people are back with us. It's 5-2. So strap in. We have our solution walkthrough section. We are conscious that I think at the last count we had 101 people who signed up for this session, and there's quite a wide variety of people and backgrounds, and I'm sure we go from a spectrum of pure dyed-in-the-wool technologists at one end to people who are more interested about the healthcare side of things and less in the technology. So before we actually go into the demo section, what I wanted to do was just to go through a couple of sort of high-level kind of points around the way we built the technology in order to sort of help people be guided through the walkthrough itself. So if we could have the first slide, please. Cool, thanks. So it was very helpful having those two kind of presentations on the first users. Those first two users use the first of the two ways that we get data into the system, and that's bulk uploads. So with that, people curate their own data sets and tables. They make sure everything is tight, anonymized, signed off before they then upload it to the system and do the clever analytics on it. What we're going to talk about now, though, and in this demo, is the other way of getting data into the systems. And if you remember back to the slide I put up earlier about the number of organisations that are connected to the Yorkshire Humber Care Record, as soon as an organisation is connected and data is mapped to the YHCR and it is safe and secure and signed off, then it's available to be pulled through using our query builder into the population health system. So really this demo is going to talk a little bit about how we do that in practice, and that is the bit that's really quite novel from what we have built. So once we've got data in there, the other thing that's a little bit different about our tool set from others is that we would like to serve the needs of a wide range of users. And as Jeff said earlier, some people like to use their own favoured products like Tableau, which is a very user-friendly data visualization tool. Others like to use different tools, and some people like to program it themselves using languages like Python. So what we've done is within the platform, we've made available a range of tools that people can use according to their own preferences and their own experience levels. Okay, so that's a key point about our system. You'll hear Steve in the presentation in a second talk a lot about FHIR, and we don't mean necessarily fire as in you put it in your living room and light it. This stands for Fast Healthcare Interoperability Resources, and it's a modern way of categorizing data and being able to request data items. So you'll hear him describe that, and we used FHIR as the kind of language and the way of working across the whole of our Yorkshire and Humber Care record, and that's part of the future-proofing things. I've got a couple of people on the demo that you're about to see. One is Steve, who oversaw the build of the querying system, where people can go and ask for elements of data sets on an individual or a population rather. And then we've got Alistair, who then takes the data once it's in the secure system and turns it into products or dashboards or visualizations. So you'll hear both of those on the demonstration. So if we're ready, can we just kick off the video? Whilst it's playing, please fire in technical questions. Steve's on our panel later, and he'll be able to sort of pick up any deep tech ones that myself or Monica can't answer. So please fire away with your questions. Thank you.